Is my brain bleeding? Should I pay $2,500 to find out? This is a question I faced with my mom at 3 in the morning at a hospital. It seems to be there should be a simple answer. Do it for your well-being and follow professional healthcare advice. Yet this is a question that many face between cost and health, and some end up paying for with their life. Medicare for All is a current and controversial topic. It is an issue in the 2020 presidential election, specifically in Sanders' campaign, and also with the current coronavirus and stress on the healthcare system. It is also controversial down Republican and Democratic lines, and I stand for Medicare for All. I have completed thorough research on the topic to understand the system and understand both sides of the argument. There are 3 reasons that the United States federal government should implement Medicare for All. First is to alleviate the hardships of the medical care expenses. Second is to make healthcare more accessible. And third, that despite my opposition's claims, it is worth the increase in taxes. First is my first point. The current problem in the United States are high levels of medical bankruptcy and medical debt. According to CNBC, 530,000 families turn to bankruptcy because of medical issues and bills, and 2/3 of all bankruptcies cite medical issue as a reason for filing. While not all file for bankruptcy, Time magazine states that nearly 80 million people struggle with bills. And New York Times states that medical bills affect nearly 1/4 of the United States, both those who are insured and uninsured. These medical bills, according to Times Kaiser Family, cause deep financial sacrifices that can affect housing, employment, credit, and daily life. Those people that are impacted are insured. Experts say it's because their providers are narrowed, there's an increase in deductibles, and small co-payments pile up. The solution to alleviate these medical hardships is Medicare for All. The bill initially states it is to protect against the cost of health care and services. There will be a $200 cap on prescription drugs, and it will prohibit cost sharing and other charges such as deductibles, co-payments, and co-insurance. Virtually, there will be no out-of-pocket cost. The problem of these high medical expenses gives rise to also our second problem, bringing us to our second point. Medicare for All should pass because it will increase access and utilization of health care. The current issue is the cost and fear of debt causes people to forgo or deter them from healthcare services. Families USA says in 2006, 26,260 people died because of lack of insurance. Uninsured people are less likely to reserve preventive care such as screenings. This can lead to serious health issues and later on emergencies and life-threatening situations. While 27.5 million people are uninsured, the 44 million people who are underinsured are also at risk. Dr. Sarah Collins, a vice president of healthcare coverage, states that leaving so many people uninsured and underinsured affects their ability to stay healthy. Even those who are insured can delay care. Since we don't want people to be putting their health below prices, there needs to be a solution. They should not have to forgo their well-being. Thus, Medicare for All provides a solution. This national health insurance allows all citizens access to health care. This Section 104 states a non-discrimination, saying that the program must cover all U.S. residents, regardless of pre-existing conditions, race, or gender. Everyone has the same opportunity to access treatment, regardless of their financial situation, and without the limitations of costs. Section 201 states the items and services that people are entitled to. Some of these include services that people may often forgo because they don't seem as important or in the case of an emergency, such as oral and audio and vision services, as well as early and periodic screenings. Now that you've seen the solutions of Medicare for All, some are still against it. This brings us to our third point of refuting our opposition's claims. There are 3 reasons the opposition claims that the tax increase is too expensive is irrelevant. First is the net benefit. The overall advantage of improved public health and saving lives outweighs the increase in the tax. Again, those 26,000 people died because of lack of insurance. Increased access to insurance can increase the chance to save lives, which is a very important benefit. As for current public health, Dr. Steffi Woolander states that the lack of Medicare for all is forcing us to fight this epidemic with one hand tied behind our back, and that threatens everyone. The health of others, your neighbors and other people, impact you greatly. Thus, public health is crucial to society. 2. The U.S. can adopt a new policy with an increase in taxes or continue losing money and inefficiency of the current system. In 2009, the Center for American Progress estimated the lack of health insurance costs society between $124 to $248 billion per year. This is due to the cost of shortened lifespans and the loss of productivity due to reduced health of those uninsured. Dr. Stephanie Woolander states that the U.S. is wasting at least $600 billion on healthcare administration paperwork, money that could be saved by going to the simple Medicare for All system. New York Times also states that administration costs for Medicare are less than that of private insurance. 3. Yes, the taxes will be costly, but it is worth it because healthcare is a human right that all deserve. The American Bar Association, Mary Gersh, states that the very plurality of our human lives demands we protect this right as a public good. It is crucial to life and a dignified life. The U.S. Constitution states the right to life, liberty, and pursuit of happiness. Yet how can you have a right to life if you don't have a right to health? Health is necessary to life. The UN's Universal Declaration of Human Rights also states that everyone has a right to medical care and a right to the security in the event of sickness or disability. Overall, the net benefit of saving lives and improving public health, and 2, avoiding the dilemma of money currently wasted on an inefficient system, and 3, having the necessary human right to health care, clearly demonstrates the argument against Medicare is irrelevant. Now that the opposition's claim has been refuted and the argument to pass Medicare for All still stands, let's review. Today, we covered 3 reasons to pass Medicare. First was to alleviate the hardships of medical expenses. Second was to make healthcare more accessible. And third was, despite our opposition's claims, the increase in tax is irrelevant to the benefits of Medicare for All. It is time for the United States government to pass Medicare for All. We are worth it.